Thank you. Good morning, afternoon, or evening, depending on where you are joining from. For my talk, I am going to present to you research findings that speak to the harm reduction potential of electronic nicotine delivery systems, as we tend to call them, but others, the consumers tend to call them e-cigarettes, electronic vaping products, JUULs, and a whole lot of other things. This can tell this story from the perspective of the U.S. smoker, and from those of you across the Atlantic, and particularly the UK and the rest of Europe, you'll probably notice that the story of the U.S. smokers may be different than the UK or European smoker. And I'd be happy to take some questions at the end about that. But first, just want to first disclose the funding source. We don't the funding for much of this research. The primary source is from the U.S. National Institutes of Health and the Food and Drug Administration. We don't accept any funding from the tobacco or vaping industry. And I would be remiss if I didn't acknowledge the wonderful tobacco regulatory science research team at Georgia State University. If I lapse and say my findings I found, or refer to I really know that I mean, it's the work of a great and wonderful team. So just to provide some context, so as we go through several slides filled with lots of charts and graphs and numbers where these data are coming from predominantly, our Tobacco Center of Regulatory Science was a large $19 million grant, US dollar grant that over a period of 5 years that just ended. We've been conducting serial cross-sectional surveys of 6,000 US adults per year, starting in 2014. Our last one was in the December of 2018. Nationally, these are nationally representative online surveys using probability sampling from what was GfK, now is Ipsos knowledge panel. We also conducted, and for some of the slides, you'll see this, a longitudinal cohort study where we followed about 900 smokers from the 2015 survey, and we contacted them 1 year later. And depending on if I have time, I'll show you a slide that it comes from a behavioral economics experiment that we conducted through the online survey methodology with 1,200 smokers drawn from our 2017 cross-sectional survey. So with that background, as alluded to in my title, the motivating issue that our research really seeks to address, or often seeks to address, is what is the population harm reduction ends? This is the one of the critical questions that policymakers around the world, and especially in the U.S., are trying to address when faced with this relatively still new and evolving tobacco group of tobacco products. And it's a nuanced discussion, as you probably well know. I'm going to summarize it here. As you have on the harm reducing side is some pillars that you'd want to see is that they are less harmful than smoking. And this research that I'm going to present doesn't address how harmful e-cigarettes are. There is some debate, but I think it's fair to assume for this presentation that in alignment with the Royal College of Physicians and the Public Health England and the U.S. National Academies of Science and Medicine is that the continuing consensus is that ENDS are less harmful than smoking, but not harmless. And the big and important question, of course, is how much less harmful are they than smoking? But they also have to be not just less harmful to be harm reducing at the population level. They have to appeal to and be used by smokers, and critically, who completely switch to them. And I also want to put in a little parentheses here that those who wouldn't have otherwise quit without ENDS, because they are not harmless. If obviously the idea behind harm reduction for ENDS would be that these are the smokers that are otherwise having a hard time giving up nicotine altogether, and they could realize some harm reduction potential if they were to switch to a reduced harm product. On the other side, though, there's of course concerns about ENDS increasing population harm. One is that prevalent regular use among youth and non-smokers, particularly those who wouldn't otherwise have smoked or used tobacco. That if they're not effective for smokers to quit, or they deter, or even worse, they deter or delay quitting. And then there's, of course, a question about sustained or long-term dual use. Is that as bad as just smoking, or is it, as some research might suggest, are there potentially synergistic effects and increased harm from using both as opposed to just continuing to smoke? So to start off and to address one of the key questions is really asking who is using ENDS. So this slide shows results from surveys 2015 through 2018, where our measurements stayed relatively consistent. For adults, over this time, you see there isn't really a lot of change among those who are using cigarettes, the red bars. Some ups and downs, but while there's been a sort of a slow trending to increase, with the exception of ENDS use, with the exception of 2016, where there was a dip, this increase has not been all that great. And in contrast to U.S. youth, we have seen in the U.S., and this comes from not our research, but one of the gold standard surveys in the U.S. conducted by the federal government, is that high school youth has really skyrocketed, especially from 2013 to 2015, and then after a 2-year dip, it just escalated very quickly from there. And we're also seeing quite a bit of increases at the middle school level. So quite contrast to what we're seeing with adults. And I would just note, I'd be remiss if I didn't note that the U.S. smoking, and acknowledge that U.S. youth smoking has declined over these years. Some people have been inclined to attribute that to the electronic cigarettes when they're engaged in the harm reduction debate. But I think if you look at the trend line, it's questionable how much is actually attributable to electronic cigarettes versus some a trend that's been ongoing well before electronic cigarettes entered the market. And just to note, around the time that electronic cigarettes entered the market, we've had an increase in mass media and education campaign expenditures and efforts. Cigarette taxes have been slowly increasing, and we've also seen a declining normalization of smoking. Whoops, I apologize. I'm not flipping through my slides. And the looking at vaping among U.S. adult current smokers, you can see here that, this is a key population for harm reduction and for ENDS, and you see our surveys have not found any appreciable, other than 2016, any appreciable differences or changes over time. We have a pretty consistent, upper 20% range of current smokers who currently use e-cigarettes. There has been, from the 2015, somewhat of an increase in smokers who are former ENDS users, so what we might call, they might be trying and rejecting ENDS. And then, of course, we're kind of stuck around 40% of smokers who don't use have never used electronic delivery systems. Let's look at it from a different angle, and let's look at, in contrast, what is the smoking status of those who say they are currently using vaping products. And here we do see a bit of a change. The proportion that are current smokers is declined from just under 60% to about 40%. On the flip side, we see that the proportion of former smokers has recently increased, and that might be a good sign that smokers are switching and quitting combustible tobacco with the help of e-cigarettes. But concerningly, we are seeing increasing proportion of ENDS users that have never smoked cigarettes. In addition to looking at smoking status, we've also looked at ENDS use among those with mental illness or serious psychological distress, which is a tobacco health disparity population with high smoking rates. Here we see that those with serious psychological distress are more likely to be ever in current e-cigarette users. This includes current smokers as well as never smokers. And particularly, we see an increase in those with serious psychological distress who are former smokers using ENDS. So again, that might be a sign of harm reduction occurring with them switching from currently smoking. But we need more research to know for sure. And I'll just highlight a couple other subpopulation findings. So looking at current ENDS use by poverty level in smoking status, as well as on the right, sexual minority in smoking status. We do find that it's important, although we often look at ENDS use by cigarette smoking status, that there are actually other combustible tobacco products, and you can get actually somewhat misleading findings if you don't consider the reality of multi and poly use of tobacco, and especially other combustible tobacco products. So we do see a difference here on the left in the proportion that use ENDS for those who are current non-cigarette combustible users, with those below poverty much more likely to use ENDS otherwise. We don't see that for current cigarette smokers. And somewhat of a same conclusion for those of sexual minority identification. So just to recap this section of the presentation, who is using them? We do note that adults are using them and increasing so, especially adult smokers, but the trends are increasing among former smokers, which is probably a good thing for harm reduction, but also among never smokers, which is almost certainly not a good thing. I'll come back to this later, but note that 40% of smokers have not tried ENDS, despite some of the messaging and marketing around their potential to be help them quit smoking. And 31% have tried ENDS but have discontinued. Concerningly, youth are using them to a much greater extent, and the trend is quite horrible, to put it frankly. We see increases in daily ENDS use as well. I didn't show that data, but daily regular ENDS use and youth smoking is decreasing, but there's of course question, as I've alluded, of how much, if any, is attributable to ENDS use increases. And we find that certain select population, tobacco disparity populations, such as those with severe psychological distress, sexual minorities, low SES populations, among others, are more likely to use ENDS, but mostly among those who are smoking combustible tobacco. So that's, I would argue, a good thing. But there still remains the question, will ENDS increase or decrease tobacco-related health disparities in these populations? So, and that gets to another pillar of that balance and the harm reduction discussion, is to what extent are smokers who are using ENDS, are they quitting smoking? And just to start this section off, I want to just remind people that most smokers, and here we show about 80% of current smokers, report high or very high discontent due to their inability to quit, the perceived addiction, and regret about having ever started smoking. And that's aligned with about 75+% that we find internationally and within the US that really wish they never started and would like to quit smoking. So in our longitudinal cohort study that I had mentioned at the beginning, we took JUUL smokers and ENDS users in the beginning at baseline, and followed them up 1 year later to assess their vaping and smoking status. And here we find that the vast majority, 89%, were still smoking 1 year later, split about half and half between continuing to dual use both products or having gone back to continued smoking but quitting electronic cigarettes. Only 11% had quit smoking, and a small 7% had quit both products. And this slide shows adjusted odds ratios where we compare those who had used those smokers who had used electronic cigarettes versus the reference group here is those who had not used electronic cigarettes over this 1 year period. And We found that those who were using electronic cigarettes, which replicates many U.S. cohort studies, had lower odds of being smoke-free 12 months later. And we adjusted for a number of factors, socio-demographic factors, or quit history intentions, or smoking intensity, and several other potential confounds. We didn't find any differences depending on whether they used daily or non-daily, whether they were using ENDS, self-reported ENDS for quitting smoking or not, and we did find some non-statistically significant differences in what type of e-cigarette product they use. But again, none of this would suggest that in our population at this period of time, we're under real-world use conditions, we're helping smokers quit at a population level. So given that, what are the factors that are affecting smokers' use or non-use of ENDS and their smoking outcomes? So we've asked them, and this question is borrowed from the UK's ASH survey, their 2016 survey, and we asked them what are the reasons, those who have smokers who have not tried electronic vapor products, we asked them which of the following are the reasons you have not tried, and this is 2017, these are actually a pool of 2017 and 18 data, so they're a bit more recent. And we find that the predominant reasons for not having tried, and they were able to select a number of options for this question, is they don't want to substitute addiction for another. They were concerned but that they're not safe enough, and they don't think they could help them quit. And related to perceived safety, and maybe concerns about addiction, we also have assessed over multiple years the perceptions of harm of e-cigarettes compared to or relative to smoking cigarettes, and we find that over time, and this is to a greater extent than I know UK's track a somewhat similar trend, but of course starting at much more levels, that there's a rapidly increasing and substantial proportion of US adults, including current smokers, who are misinformed of the relative risk of ENDS, perceiving them to be equally or more harmful than cigarettes. And we had a lot of, as you probably know from the news over the last year, a lot of negative publicity around e-cigarettes related to electronic vaping product, lung related injury, and I expect that this has increased, but I don't have newer data yet. So in our other research, we have shown a relatively strong association between the perceptions of risk of using e-cigarettes and being lower odds of using e-cigarettes. So risk perceptions do seem to be important in smokers' decisions to use e-cigarettes. A little bit of a tangent, but I guess tied somewhat in terms of health communication to the last presentation, is when we think about these misperceptions and that might be deterring smokers from using ENDS or affecting the patterns of use, with that in mind, we looked at who do smokers trust as health sources, and we do find that although there are high levels of misperceptions and uncertainty about the health effects of ENDS, public trust in health experts and FDA is positive and greater than the media or tobacco vapor industry, which is, I would say, overall reassuring, might be even surprising for some people, especially in the media and government. And we do find in separate research that whom adults trust is quite important. Greater trust towards or less distrust towards the tobacco and vapor industry is linked to perceptions of lower risk of daily ENDS use, but also greater uncertainty about those risks and greater odds of using. And that misperceptions that ENDS are equally or more harmful than cigarettes is associated with lower likelihood that they would be currently using ENDS and fewer number of days, if they are using, the fewer number of days that they've used in the past month. We've also looked at research looking at specifically at the perception of perceived risk of fire or explosion-related injury from ENDS. These represent a really very small, relatively rare occurrence of ENDS use, but they are very graphic, and those who study risk perceptions and risk communications can imagine that they have probably an outsized effect on perceptions, and we do find that half of smokers perceive risk as medium to high. 11 to 24%, 11 to 37% were actually uncertain about the risk. And this specific perceived risk is more likely to lead to people smokers to more likely to believe ends are equally or more harmful than smoking, less likely to believe that the positive aspects of the ends use outweigh the negatives, and less likely to be current ends users. We also asked then what are the main reasons that they stopped using electronic vapor products, and while concerns about safety, and this one they could only pick one main reason. Concerns about safety was up there as a concern, but really we see that really the reason that smokers who tried but ultimately rejected them is because they predominantly didn't feel like smoking a cigarette and didn't help them craving. And then of course there's the curiosity factor that was some reason, but some had cited. And so we dug deeper into this, and we even dug deeper until we asked that one question earlier back. We find back in 2014, smokers rejected ends were more likely to report that ends are less enjoyable than cigarettes. And this held across different patterns of use. And who uses it was only those who had actually switched, and not surprisingly, those who had switched from smoking to e-cigarettes completely said that e-cigarettes were more enjoyable. And here, in considering whether to vape, smokers consider not only the potential risk, but they also weigh the potential benefits. And they have to weigh these two together in their decisions on whether to try or not try vaping products. And we find that current smokers who reject e-cigarettes were more likely to say that the negatives outweigh the positives. So just to quickly recap, within the context of the 2015 to 2016 U.S. regulatory and tobacco vaping market landscape and real-world use, there's no evidence that we found of ends helping smokers quit at rates that were higher than smokers who were not using the products. Some proximal factors that we've identified that affect smokers' use of e-cigarettes is their harm perceptions, and related to that is trust of the message source on ends' health effects. We find also, importantly, general dissatisfaction and lack of enjoyability to using e-cigarettes relative to smoking cigarettes, which I could unpack in Q&A. I'm going to move through some of these final slides relatively quickly, but I'm almost done. But as I prefaced the recap, a lot of our research, the evolving marketplace makes it very difficult for the research to keep up, if it's ever possible to keep up with the products that are on the market. And we have now what we call fourth generation products. They typically are smaller, discreet, more technologically advanced, and have higher nicotine delivery using nicotine salt-based formulation. And this has been, and JUUL is one of the initial products in this category, and they've gotten a lot of they're found internationally, although they're pulling out of some of the international markets, but they have gotten a lot of negative attention because they've been blamed for the beginning of the youth vaping epidemic in the US and lately perhaps Canada. Colleagues have looked at their marketing strategy behind that. Youth-oriented advertising initially. Of course, it doesn't help, or it does help maybe for smokers, but maybe not keeping youth from using, is that the nicotine delivery is higher than the earlier generation e-cigarettes using free-base nicotine. And we've looked at who's using JUUL Use among US adults to see if it's, of course we see that youth are using the product, and that's of great concern, but are adults using them? And we do find that they are, interestingly, and not surprisingly, that it's predominantly younger adults. And race and ethnicity, we find some interesting findings, whereas there's really not much racial, I think, differences in the U.S. among ENDS current use. But when we look at JUUL, African Americans are, as well as Hispanics, are more likely than white non-Hispanics to use JUUL. And that might be related to using it with cannabis, so not unintended use. And we do find, though, that current smokers are more likely to use JUUL they are to use other ends. Looking at reasons for using ends. We do find, in terms of compared to the earlier products, smokers complained about them not being like smoking. We find that that there is a higher percentage of smokers. Who are JUUL users are more likely to say it feels like smoking a regular cigarette than smokers who use other e-cigarette products, excluding JUUL. And also, but very, very popular is the flavors that JUUL comes in. This is across the board, not just for JUUL, it's for e-cigarettes as well, but it is cited as a main reason for choosing the brand that they choose, which the flavors has been an important question that policymakers are struggling with, because on the one hand, you have smokers and maybe giving them the option of a non-tobacco menthol flavors might help them be more successful at using e-cigarettes to quit. At the same time, we know flavors are very appealing to kids. JUUL has, because of pressure and regulatory action more recently in the U.S., has removed almost all of the flavored options from the market, except for mint and menthol. Actually, they took mint off. I'm sorry, later. And I think I'm running out of time. Just saying, we have some evidence that e-cigarette smokers, they may initiate e-cigarettes with tobacco-flavored e-cigarettes, but if they're continue to use, they are more likely to be using other flavors other than tobacco. And in more recent research we published, we do find that those users of tobacco and menthol flavored e-cigarettes are less likely to quit smoking and are more likely to be a dual user. And we've done, and just allude to that behavioral economics experiment that I mentioned in the beginning, we have found that in an experimental paradigm that smokers who prefer electronic vaping products prefer them because they're less harmful than cigarettes. Again, a no-brainer, but that they're effective in helping smokers quit, they're lower priced, and that they're not menthol flavored. That was for those who are non-menthol smokers specifically. And then our team is currently doing research and tracking the new tobacco product in the market. This is a heated tobacco product. UK has some products. We have currently one primary product in the market, only one that's authorized to be marketed in the US, and that's IQOS. And we're tracking that. It launched in my home city of Atlanta, and stay tuned for those results in the next year or so. So just to recap, there's potential for newer ENDS and heated tobacco products to better help smokers quit with better nicotine delivery and maybe a more comparable experience of smoking. And non-tobacco flavors might be important in this. But there are some very major challenges. Adoption among smokers whom tend to be lower income. It might be impeded by higher initial costs and increasing taxes of e-cigarettes in various jurisdictions. The appeal of youth, which is leading to regulatory action, is also going to be a major challenge. Perceptions of harm, and of course we're trying to track right now what COVID-19 is doing to smokers in their smoking, but also their use of these potentially reduced harm products. And the big question is, will these newer products overcome the negative publicity, regulatory and policy actions, and smokers' perceptions of and experiences with earlier generation products? I don't have an answer to that question. Maybe the better question is, how could these newer products overcome these barriers? So, with that being said, thank you. I'd be happy to take questions if there's time.
Many thanks, Dr. Scott Weaver. We have had some questions coming in, and you've just managed to answer a couple of those with the latter part of your talk around menthol cigarettes was one of them. So another question is, studies have shown that people mistakenly believe that nicotine-free cigarettes are safe to smoke, and in some circumstances result in people smoking more. So do you find that this is similar with ENDS? So although there's reduced harm, the quantity of consumption increases.
Yes. We haven't. We do have. I'm trying to go back. We've published many studies, and one study we did look at more, not perception so much, but whether they perceive what their electronic e-cigarette to have nicotine or not have nicotine, or whether they consumed nicotine. We know that with youth, there has been up until recently a great perception that e-cigarettes didn't contain nicotine. With adult smokers, they generally know that it contains nicotine. If they were using a e-cigarette product that doesn't contain nicotine, they would know it because they would be having strong cravings and withdrawal effects. So I can't really speak to whether perceptions of nicotine-free e-cigarette products among adults is leading to changes in quantity. I would think that misperceptions would have the same pattern as you described, but we haven't collected data or looked at that.
Okay, thank you. Another question, you looked at who smokers trust for their information. Have you investigated the levels of trust against the person's socioeconomic status? I think you did talk a little bit about this. If so, what does this say about how information might need to be tailored to different groups?
Right, yes, and if you caught the citation, the details are there, and I'll try to my best to remember those findings. There are lots of data that we presented in that paper, and we did include education level and income as socioeconomic factors and predictors there. And we do find that those who are low socioeconomic status and those who are lower income, they're more likely to be smokers, as we know, and tobacco users in general. They're less likely to trust government, especially Food and Drug Administration, and I think public health professionals. But still, the average trust is still high, but less likely than the higher FCS individuals. But they were more likely to trust or had less distrust of vaping and tobacco companies.
Okay, thank you. And just finally, if you can fit one more in, there have been reports of ENDS exploding, including in people's mouths. Do you find that when that these create headlines, people switch back to cigarettes?
We have evidence that they might be. Our survey was cross-sectional, and we haven't conducted an experiment where we actually it could be arguably unethically or difficult to do so, that where we show them advertisements of ENDS exploding and then see how that changes their behavior, because it could actually push them in a harm increasing direction. But based on our findings that and we haven't actually asked them specifically, I should say, about exposure to those products, but I do know other folks who have, and exposure to media presentations and public health discussions of public health officials, medical officials discussing the explosion of e-cigarettes is associated with perceiving them to be more risky, and that's associated with them being less likely to use. So I would not be surprised if that is, and in our focus groups, we do hear smokers telling us that's the reason that they have quit using e-cigarettes. So again, I don't have empirical data to support that directly, but we have a lot of data that suggests